these are exceptional times. And Peter, I think it's safe to say, probably from your experience, certainly from mine, never have I had to ask a medical officer of health come to speak and answer questions to board members as frequently or being called upon as you have. So Peter, what I would say, and again, this is meant to be an opportunity for the trustees, you iterated how important communication and understanding and getting accurate information from a public health perspective is. I just want to say I'm grateful, Peter, for you to give up your time, and I'm grateful, Ethan, for you to come as well. And we recognize, and certainly I do, the tremendous pressures you're under right now as well. And for that, we're grateful and acknowledge your leadership and your experience and the expertise that you continue to provide the region. So with that, Peter, I can't see you, but I can see your name, and I will turn it over perhaps maybe to you just to make an introductory comment, if that's okay, maybe an update as to where things are at today. And then my understanding from our executive yesterday was that there would be an opportunity for trustees just simply to ask you, authentic and unfiltered questions just out of concern for themselves as parents and trustees and the people they represent. Thank you, Peter.
So thank you very much for this kind introduction. I hope everyone can hear me okay. And I'm going to maybe as an intro introduce my colleague, Dr. Ethan Toumishey. Dr. Toumishey is a family physician who is also doing some additional training and following the Royal College residency training in public health and preventive medicine. And Dr. Toumishey is very much involved in providing guidance leadership to our teams doing case contact management. So he has very much in-depth knowledge of all the work that's being done on the case contact management side. And I've specifically asked Dr. Toumishey to join us so he can provide that update and then answer any questions you might have. I will be still here, so if there's any other questions that are more appropriate for me to answer, then I will certainly will. But I just wanted to turn to Dr. Toumishey and have him start this presentation. Thank you.
Thank you, Dr. Oglaza, and thank you everyone for the invite to join as well. I think just in starting, just maybe as situational awareness, which I think would take nobody by surprise to be here, but we are seeing significant case activity when we look. I just see a hand that's raised. All right, I could pause for questions as we're going, or
I don't think Spencer knows he put his hand up, so you can probably keep going.
Okay. So when we look at locally here, we're seeing significant case counts. We had 27 new cases as of today, bringing our active cases to 167. And this is not different from the experience that we're seeing across the province of a significant increase in case activities. And this is as related to the experience we're having with spread of variants in the community, which is significant concern. We're seeing healthcare resources used up or being filled up with response to this. We're seeing increasing case counts, and this is primarily driven through the increased transmissibility of the variants of concern that have spread. While we're seeing these increasing case counts and the health unit and the province have been responding with increased measures, when we look at the school settings, it's, I think, a remarkable job that I have to commend for our educational colleagues on efforts that they have made when we look at our local experience, both with variants of concern now and previously through the pandemic. We have not seen transmission that appears to occur within the school setting itself. We've seen a concern of a potential exposure in a bus setting. This is as recent, but this would mark as one case compared to when we have looked at the year worth of experience that we have managing cases and contacts in our community of COVID-19. And there's a multitude of factors. Some we have a good understanding of, some we're developing understanding of that contribute to that safety and understanding of the virus transmissions. And it's again, when we look at the environments within the school setting that has been created with regards to safety, the combination of screening effort when we have parents and families engaged in this, and teachers, the practices within the school, practices of cleaning and cohorting, this combination of events really seems to have contributed to the lack of transmission that we've seen in our local contexts that be there. I think it's fair to acknowledge of the biggest contributor that we've seen when we look at experience beyond ours of the level of transmission or concern within a school setting is going into the community setting. And this is the reality that we're seeing in the our local environment bears out from what we've seen around us. And there are other jurisdictions that are having to make tough choices about schools, and they have very different COVID-19 transmission dynamics and transmission around them within the community. So those factors contributing to some of these decision makings that would go in. But when we again looked at for the in-person learning for schools, these have been remarkably low chance of transmission that we have seen without seeing the case occur in the local environment. And recognizing the benefits when we're considering the holistic view of health as a public health agency, that the school environments are contributing for students and families. I think as things that we recognize as being a part of our longitudinal view of public health and in the community beyond the pandemic response just in and of itself. And the way of balances that we see with making recommendations with regards to school safety and aspects of remote learning and these sort of things, the positive health effects of school and in person, and how this can contribute to the inequities and that may be seen in the communities and that schools help to address are factors that weigh as well. So in the, we've had a very close relationship with our school partners, lots of communication. I'd say that from our end, it's been fantastic to work with our school partners on this, on all aspects of the safety parameters, public health measures, and then responding to cases that have been associated and the response to quickly respond and do so in an accurate and wholesome manner there. So we've had a very close relationship over the last year with our educational partners. This has continued to evolve and respond to the case numbers and the case activities that we've seen. Locally, we've worked on, or recently we've worked on measures such as for contact notification. And I think if there's a kind of endorsement of the partnership that we've developed, it can be seen in working through these the new processes in place of working with the schools more directly for contact notification. I think that speaks to the partnership that has been built up over the past few years. I think that this spring kind of incorporates the experience that we have seen for a case dynamics and case transmission, and then from working towards the environment to create it as safe as we can manage to be there. And I would put up as being the low risk of transmission that we've seen locally as being one of the surprisingly fantastic elements of the past year that be there. I really have to credit everybody that's been involved. And that brings up for what we've seen from the case management side of working with the team, providing advice with the team, in addition to the different processes that we're going through locally. There have been some announcements just for vaccination schedules. So those will be working. I think there may be some questions on that one. We'll try to answer those as best we can for vaccination aspects and how that's fitting in within the plan, and some aspects that were announced with today. But those are being incorporated within our immunization team working together for how this is going to be rolled out in details, but may not go down to fine specific detail with that, as anticipate there's probably some more pointed questions on those aspects. But that's from the experience of working directly with the both the case and contact management team over the past year, as well as the school health team over the past year of our processes and how we've responded to the pandemic thus far. So I think from high point, Sean, I think I captured that. There may be aspects I can certainly discuss in more detail, or any questions, or however that may work.
So maybe just before, because this isn't about me, I get to talk to Peter and vicariously you, I guess, Ethan, fairly frequently as needed under the circumstances. More of an opportunity for the trustees. What I would say, to everyone, perhaps as maybe just a bit of a segue, is in spite of the low transmission, if you will, in schools, what we're not seeing is that correlating to low anxiety and low apprehension in the community. And I think for that reason, the information, and more importantly, accurate information from medical professionals, and I readily admit I'm not an epidemiologist or a medical officer of health, I'm a teacher. So for that reason, there's probably questions that are reflecting the same anxiety in the community that board members are feeling. And, even today we were on a call with the minister after the announcement, and there's anxiety amongst school boards everywhere. So not uncommon, but your assessment of the situation and the fact that we had a high case count today. As you know, Ethan, we had 2 cases in our own board, 2 students, one at East Side, grade 11, and a grade 9 student at Center Hastings and Madoc. So we're not immune from this. And of course, we follow the protocols and work very closely hand in hand with your staff as well at Public Health. So I'm going to stop, trustees, or maybe I should back up and acknowledge Peter as well and Ethan's comments. Lucille, I don't know, maybe I'll stop and turn it over to you, okay? That might be most appropriate.
Okay, thank you very much. Now I know some trustees have some questions, so who would like to go first? Trustee Chatton, did you have any questions?
Yes, I've got several. I'm not sure.
Okay, go ahead.
I'm not sure if you can see all of us, but I know Krista McConnell has questions, and I think Spencer had his hand up earlier as well.
Okay.
If you want to make a list, I'm not sure if you've got a list going.
Okay, I don't see Krista on my screen, so that's good. Thank you.
Okay. So first off, Sean, I have a question for you. Is it 9 schools out of our 40 that are affected right now with COVID cases?
Is it 9 schools? No. We have North Trenton. We have Prince Charles Trenton. We had Trent River, East Side today, Center Hastings. And we had I'm sorry?
Queen Victoria?
And Queen Victoria, yes, that's correct.
Thank you, I appreciate that, that specification. And that makes a difference to some of the questions that I'm going to be asking, because that's representative of 15% of our school board, as opposed to what I thought it was, which was 25%, if it was like 9 out of 40. But how is it possible for this new, more contagious variant to be bypassing the children and staff in the schools when there is no measure that we can take to ensure that they're not going out in the community? We don't have any. My question is surrounding what parents are coming to me about and saying how much of this is luck that the schools have not ended up being transmission spots. And I have no answer for that for them. Any assistance that you can give me with that particular question would be very helpful. Would you like me to ask all of the questions or just wait one by one?
No, just go one by one. So let's answer that question, please. How much of this is luck? Good question.
No, I think it's a fantastic question. I just noticing before Dr. Oglaza, what were you saying? Okay. When we look at the reality of what we've seen here, and this isn't a question just specifically locally, but it's been looked at within the scientific community writ large when we looked at for COVID-19. This has been, of course, a massive question worldwide. We look at a combination of things. So, and reference that of there'll be the aspects that we've understand really well and the stuff that we're developing our understanding of. So I'll start with the aspects of what we're understanding very well is that we have, even with the variants of concern, we see increased transmissibility. That part is certainly clear, but the how it is transmitted, our understanding is very good as far as the method of transmission. Then the advice of safety parameters is very clear on there. So when we're seeing this outside of very particular circumstances, droplets, where the distancing, masking incorporated have very specific effects, and where they've been very consistently applied within the schools, those have a measure of safety. And if we'll back to a more general of how we try and prevent risk or risk of transmission, it can be viewed in a few ways of either how a chain of transmission can arise or the control measures that be there. And the most effective control measures are going to be what has been done, where the elimination of risk, where the screening criteria that parents have been engaging in, where the teacher is screening kids out if we find symptoms during the school day. These significantly reduce the risk, where we have administrative controls. So the concept of cohorting that would reduce the potential for spread and mixing, this has an effect as well. And when we see for the personal protective equipment and source control that people have had with the masking, eye protection for the teachers, when we see these characteristics or like interventions added together with a very robust understanding of how this virus is transmitted, that has contributed to the safety to be there. The aspects that I think as a scientific community are learning more and more is the transmission dynamics, one of the variants that are popping up, but then of the children and to adults, we see lower transmission that's been seen within younger children in particular. The science on that, I don't think has the full explanation as to that, but it's been seen repeatedly in the epidemiologic literature that be there. So particularly in younger ages. So that's I don't have the full scientific aspects that's being built up that be there. So those aspects we may not have the full answers to, but it has borne out to the experience. When we say whether this being luck, because I want to have the contrast to other jurisdictions where we have seen more cases in schools. The level of case counts that we see within the community certainly has a factor of how much COVID-19 you're going to see in a school within that community to be there. And the lower rates of COVID-19 activity that we've seen in the Hastings and Prince Edward counties certainly contributes to the reality that we've seen within the schools. But that being said, even in case examples and jurisdictions where they have had high case activity, the schools and utilizing these safety parameters continue to have had lower risk of transmission from what they could estimate than we'd see in other settings within the community. So I think that to summarize, I appreciate a longer answer to the question, but I think it's a very important question. It's one that we've been asking and everyone's been asking since the start of this, but it's the combination of characteristics of the virus and what we're understanding, and then the combination of safety interventions that have been put in place by public health, by the school boards, by parents and families, all of these things have added together to contribute.
Thank you. I see Dr. Oglaza had his hand up too. Does he want to speak now?
Yes, and thank you very much, and thank you, Dr. Toumishey. That was really excellent. I just wanted to put that a little bit in perspective. I know that on everyone's mind is, are children going to school? Are they either safer in school than outside of school? And are there low transmission or no outbreaks in schools to date, other than that one scenario with the school bus? Is that really an issue of lack, or is this something going on that really makes the school a safer place? And this is something we have to understand, that our common understanding, and just medical community as well, and as well as common understanding of parents, of everyone, is that anytime there's a respiratory illness other than COVID, children tend to have higher viral loads, children tend to get sicker, and children tend to be transmitting it more easily. In all of our pandemic planning for influenza way back, there was a notion of having to close school because children would be what we call incubators. They would multiply the virus and spread it to their parents and get sick among each other and then bring it home. And that's what would drive the transmission with pathogens like influenza. That is fortunately, through whatever luck or just the nature thing, that COVID does not do this. COVID does not multiply, does not replicate in children the same way as other viruses such as influenza. It also doesn't make the children sicker than general population. Remarkably, children are much, the course of COVID, other than very extraordinary, rare circumstances, the course of COVID is much lighter than other illnesses such as influenza, for example. So that's the one remarkable thing. What we also know about COVID is the predominant mode of transmission is through someone who has symptoms. The asymptomatic spread, which is very much on everyone's mind and the big source of anxiety, is really a very small fraction of the spread. It's not driving the transmission of this disease in Ontario or anywhere in the world. This disease is driven by people who have symptoms but continue to interact with others. So with our robust systems in schools that prevent children from entering the classroom through all the screening and all the observation that happens where they're removed from the cohort, not even admitted or let into the school if they have symptoms. That is all reducing the main driver of transmission, being symptomatic. When there were studies done in very recent past about how the asymptomatic versus symptomatic spread differ, they were doing studies in the household, which is the highest risk members of the same household, and it was concluded that, first of all, children are much less likely to transmit, and they're even less likely to transmit when asymptomatic. So that risk for asymptomatic is 3% or something, which basically means that in a household where someone is asymptomatic case of COVID, the chance of their household member to become sick from that exposure is 3%, compared to, for example, 25% if someone is exhibiting symptoms. So the combination of screening, this is the first line of defense. The combination of screening, the fact that asymptomatic disease is not very transmissible, and that children in general are much less effective in having the virus replicated in them. So they're far less likely to spread it. These are the factors that are completely outside of the lack. These are the parameters, features of the pathogen that happens to behave like this in this specific population. So this is basically a consequence of the nature of the pathogen, and that's something that I think is really important to emphasize. As far as the cases are concerned, if we have a widespread community spread, it is understandable that children who are household members or other people who are cases in the community, they will get exposed and they can get sick. They can be infected. They can exhibit symptoms, and we could see that children in the past second wave, when we had about at our peak of cases in December, the children, the cases among the school age children were less than 10% of total cases, which was representing fairly similar to the proportional to the population of children proportion of population that are children. So these cases were proportional, but none of these cases then resulted in transmission in school. So we have cases in the school system right now, which are a representation of the risk in the community as a whole, but only one circumstance when on the bus there are cases that were on the same identified on the same bus, and we are assuming that they are linked, but they may not very well not be linked. We are taking that extra step to assume they're linked and consider this an outbreak, looking at definitions alone. But in terms of risk, in terms of the track record, we know that school setting is very unlikely to result in transmission, which is something that we need to emphasize. And we also need to emphasize that there are tremendous benefits of in-person learning, where hundreds of children are benefiting and their health is benefiting long term from that opportunity, and transition to virtual learning may also enhance some of the inequities that the school system and in-person learning tends to equalize among children from different demographics, different environments. So that's something that really we need to weigh the actual risk. We need to weigh the risk perception, reassure parents, but also emphasize the tremendous importance of in-person education and the role and the profound role it has on children's future lives and health. So I just wanted to add this as a preamble, which I want to make sure that that's already out for us to put all the other discussions in that context. So thank you very much.
Thank you. Next question, Lisa Ann.
Thank you. Supplemental to that, actually, I'm going to direct this at you, Dr. Oglaza. About a month ago, you had said that it was in terms of a cost-benefit scenario, asymptomatic testing in schools was not advised because of the pressures that it would put on the mental health of the children that were in the schools. Is that now a different story, given that we are the highest that we've been so far for this area, as I understand it, with 167 cases in our community? Should we start the asymptomatic testing in the schools at this point, in your opinion?
So this is something where we this is the level of spread that we have where asymptomatic screening might be considered. It's a very different scenario that it was last time we spoke. Last time we spoke, the rate per 100,000 weekly rate per 100,000 population was on February 28, I checked, was 3 per 100,000. Right now, we are over 86 or so per 100,000. So very different scenario. This is where additional measures such as asymptomatic screening might be considered. It makes the pretest probability of a positive higher than what it was before. So that's one of the measures, but it still needs to be taken in the context of what is the best method of asymptomatic screening. Should it be the rapid test? Should it be the PCR based test? So there's some other questions that still remain. Are we going to use the gold standard? Are we going to use the test that has that intrinsic false positive rate? So these are very important questions. That's something that we can certainly look at with the numbers we have currently. And I'll let Dr. Toumishey to maybe add to this, because he's very much involved in the asymptomatic or with the testing and case contact management. Maybe Dr. Toumishey could add something to it as well.
Certainly. So certainly a different risk profile as we've moved through the time on there. I think it's something that from as a public health agent, it could explore again when we look at the absolute. Like we've seen higher levels of case counts here with recent surges. We'll be watching to see how our case activity as for the cost benefit analysis that was being spoken of before. We'd be looking at how stable our case counts are as we've seen a very rapid rise to be there, but certainly the pre-test probability, so how much at one time the people have the virus in the community, factors incredibly into the usefulness of that test. And that's what we've seen, and we have a lot of experience from it coming from long-term care setting, where that was involved for quite a length of time. Yeah.
Lucille, do you want me to keep going?
Yeah, can you just please keep going until you're done, and then we'll move on to others.
Okay.
Thank you.
In the last 2 days ago, we were at 137. Today we're at 167 case counts in the community. I'm concerned about what we're going to be looking at 3 days from now and how that's going to impact. So this is more, I guess, towards Sean. How is this going to impact some of the teachers and some of the students that are going to be isolating over this next week, where they would normally be actually taking a break, and especially with their mental health being at an absolute max at this moment? Are we going to be making any kind of concessions for those teachers that do end up in isolation or having to isolate over this next week because of the increase in community spread? Because it may not be in schools that they're getting it, but our teachers are at a high risk.
Right. So just assuming, because we're not in a formal board meeting, I'm just going to respond directly, if that's okay, with Lucille's permission. So a couple things there, Lisa Ann. You know, I was probably more surprised than I wasn't that, and of course, I've prefaced this by saying I'm not the medical officials, so the data and the decisions that Dr. Toumishey and Dr. Oglaza use, and then the provincial medical officer of health uses, those are data sets that I don't. I say that because I was a bit surprised that given the trajectory where things were going last week, when we were notified by the province when they announced the emergency break, that we weren't closed for these 4 days after the Easter break. I was, and there were reasons for it. I know Dr. Oglaza can comment, but I know long weekends, typically testing, there's a couple of days where there isn't testing to give people a break and catch their breath, and sometimes you see a bit of a rise later in the week, and I didn't know what that meant for us. We were anticipating some activity over the weekend. It started off, you know, Lisa, it started off really busy, crazy busy on Friday and Saturday. I was quite concerned about Tabitha particularly, who is our front person. And then we didn't have any more activity. That not to say, we have 2 days now. A letter will go home tomorrow, given the provincial announcement today, to all families. We have 9 days, 2 weekends and 5 days next week as a part of our spring break to, one, let people try and catch their breath. And Lisa, I'm going to tell you right now, 9 days isn't going to do it. Like 9 days is a scratch. Like I think we're at a point where when people talk about work fatigue and exhaustion, and it's not just one employee group, I want to make sure, like I know teachers are key, but I'm telling you, our EAs who work with special needs students, early childhood educators, custodians, maintenance, you know what, my PVPs who I met with today, this afternoon, backbone, and my senior staff, up including myself, we're exhausted. So the 9 days will be an opportunity to catch some sleep, and we can't go anywhere, you know, so there's that. We hopefully that could play into our hands. But Dr. Oglaza and Dr. Toumishey and the virus spread, like they're still going to be doing the testing, or not them specifically, it's a bit unfair, but the testing will continue. I suspect, and Peter, you correct me, you know, from your position, if the virus spread continues to go up and we see case counts involving our schools, then I think it would be safe to say we would reserve the right to evaluate that situation closer to the end of next week and what that means for our schools. I made the decision with the team on Saturday night to go to remote learning at North Trenton because of the small number of students there and the small number of classes for most of the students, and we would do the same. I think, you know, I hate to say I can't give you the final answer you're probably looking for because we have to wait and see what the count is, but I will say we are seeing a significant increase in staff absences. We are seeing a significant statistic, and to Trustee McConnell's question yesterday, 741 students that were kept home yesterday by their parents across the Hastings Prince Edward District School Board, by parents who made the choice to keep their kids home for whatever prerogative and decision they wanted to make as a family. That is a statistically significant number, and some of those families made the decision to keep their kids home regardless for the whole week anyways. So I think, you know, staff are going to continue to be away. Depending on what happens in the next week and a half will impact what staff do. But I think until the end of the 2021 school year, we're going to see staff absences in rates that we've never seen before. And we have had to cancel some classes. We've had to cover classes. We've actually had to not fill jobs. And we are working to try and fill emergency staff with actually non-qualified staff, but capable people, qualified people, so that kids can come to school. And I don't anticipate that, Lisanne, to be candid, I don't anticipate that getting miraculously better after. And Peter, I don't know what your thoughts are about the Easter or the spring break. I say Easter break. This is our March break that's been postponed for 6 weeks. And I would say we are seeing a run on staff absences, including those who are getting tested, but we're seeing lots of sick illness days, which I think you could probably read into exhaustion, fatigue, mental exhaustion, and all those things that go with it. So I don't know what your thoughts are about the case counts and predicting, you know, what we might see into next week with the new announcement today. But we're hoping that the 9 days away will give people a chance to catch their breath.
And I've got one more question, and then I'll go to anybody else who wants to ask. The threshold for how many cases are in the community that would create the closure or a Section 22 closure of our schools. What is that threshold?
So I can take that question, because this is really there isn't a threshold per se in terms of this number of cases increases. It's more about the assessment to what's happening. If we're seeing that there is a evidence of transmission within the schools, and if we see that schools are driving transmission in the community, that would be something that, in order to stop that driver of transmission, the Section 22 is implemented. So it's really, and I'll give an example. If let's say if we see the unstructured private gatherings of are driving transmission, the Section 22 comes to limit the gathering site to a single household or 5 people. That's the use of Section 22. In this situation, the school closure could be resulting from 2 different mechanisms, distinct mechanisms. One is that if we see sporadic cases affecting various cohorts, entire cohort need to be sent home to self-isolate. And that cohort is then excluded from in-person learning because they are contact of a case, they need to self-isolate. Once you have sufficient number of cohorts from that community spread and sporadic cases on self-isolation, that whole school may need to close for operational reason and may move to virtual learning. And that's a very different scenario than a scenario where we have evidence of spread inside of the school cohort, that community cases are driven by the spread inside schools. So 2 very distinct scenarios, and one is resulting in closure for operational reasons. The other one is resulting in closure from the epidemiological reasons and kind of controlling the outbreak. So that's why there isn't really a threshold, numerical threshold at which point we do one thing or another. It's more of a overall assessment of the situation, if that makes sense. I hope I was able to articulate that clearly.
Thank you.
Yeah, that's from me for now.
Okay, thank you, Lisanne. Okay. Oh, Dr. Toumishey, do you want to say something? Toumishey?
Yeah, Toumishey, that's great. Ethan works.
Thank you.
Just wanted to add a point that may have been helpful for some of the conversation just previously to this as well, where we're trying to anticipate the cases that may arise in the next coming days to week. And if there's something we have had experience with multiple times, is that we are coming after Easter break, these times when families tend to get together. when we look at the cases that have come up, this could be a start of the bump in cases that we typically see at these gathering times. When we look at the actual case counts, so the median, so the 50% of cases are going to arise 5 days after their exposure where the transmission occurred. And then people may not get tested on the first day of symptoms. It may be a day or two for tests to come back. So we're seeing, when the cases start to arise, we're seeing transmissions that were occurring, going at least a week usually to going out to the 2 weeks prior. And that also, so bringing this back to when we've seen Easter as being a high-risk event where people may have been gathering or leading up to it, leading to transmissions, and the cases that have surged up, I think we can expect to see continued cases coming over the next couple of days. That would not be surprising. And then for the interventions that have been done, and it's more of going to the case rising, like that's just from managing, from the case and contact management side. That's what I'd anticipate, just for what we understand. When we see interventions like the restrictions actually changing transmission events, breaking those chains. So when we've introduced new rules, new processes are coming from the province, because of that time between when a transmission would have occurred to when they get symptoms to when they get tested, it can take, we're looking at the 2 to 3 weeks before we actually see the transmissions that didn't occur to be there. So whenever we see, have a new case that's documented, it is looking a little bit back of what the transmissions happen. So getting back to the anticipated or the next little while, I would be expecting that we are going to see cases, especially with this high risk event for what we've seen, and then to see the cases turn down because of the transmissions that didn't occur is going towards a 2 to 3 week if we see that effect.
Thank you. Okay, Spencer had his hand up first, so we're going to go to Spencer.
I know we couldn't hear him, but it looked like his just mouth reading. He said he didn't have a question.
Okay, thank you. And then Krista McConnell, and then I see Allison's hand.
Thanks, Lucille. A few of my questions were already answered, which is great. One question I did have left to ask was about, based on the scheduling that we have for going on for vaccinations right now in the community, how soon do you anticipate that we will probably start to vaccinate our staff members?
So I can get started, and Dr. Oglaza can add in for details to be there. There, as noted with some of the vaccine prioritization, that there have been aspects of the educational sector that have been moved up in the prioritization. So how, and the pre-registration in various degrees have been available. The team is working very actively right now on the plan of when particularly that's coming in. So I don't think I'd be able to provide a specific date, but that's being moved up. And I think I anticipate this is talking in the weeks realm that would be there. When we look at for broader vaccine rollout, is included within, we're looking at the next phase of the overall provincial plan that be there. The greatest factor for the rollout is going to be the vaccine supply that gets distributed down, and we've had a fairly consistent supply at this point. to now, after initial where there was some variability of the supply that was occurring locally, but the clinics have gone a consistent supply and are running be able to manage with that. So putting those pieces together, anticipate the planning is going towards the end of April will probably be the earliest that we're seeing, big changes being there, and more a May time for as they're moving through the phases towards that next phase of where teacher, essential workers and education that more broadly being included with the assumptions of the consistency of the vaccine supply and those aspects. But I think broadly, that's what it'd be looking at. And Dr. Oglaza may be able to give more specifics on that.
So thank you, Dr. Toumishey. So the main thing from my perspective to communicate here is that all of these decisions are driven by the province. And often we find out about these new developments very shortly before the general public knows. So we just found out about this new announcement today that there's going to be vaccination available for education workers who work with special education needs students, and we know that that's something that may start as early as next week in Toronto, Peel, and other hotspot GTA regions, and then we'll be moving to other parts of the province. But I'm anticipating more information will come on this, and this is we don't have all that information yet. This is what's being shared with us by the ministry, very much close to the date when it goes live. So if we have anything, we will definitely share that with through our communication channels. But at this point, I don't have any details.
Okay, thank you.
Next, we will move to Allison Kelly, please.
Thank you, Lucia. Hello, doctors. I'm Allison. I live in South Prince Edward, so that's where I am. Just kind of, Peter, following off of, Dr. Oglaza, off of what you were just talking about. It's my understanding that the school boards in the Niagara region have already gone ahead and vaccinated their special education staff members and are actually moving forward with vaccinating their teachers and other teaching staff next week. And it was my understanding in speaking to a trustee from that region that they had been advocating with their public health to be able to move that forward. So I know you mentioned that this was driven by the province, and I'm just curious if there's an opportunity for us to follow the similar priority and the traction that Niagara region is doing.
So I can answer that. I cannot really speak for what decision process or rationale was given and under what circumstances this was done in other jurisdictions. From what I can tell from what we do locally, we are following the guidance and direction from the ministry. They are running the vaccination rollout, and the priority groups are given to us in the form of memos, which we follow. So that's really, I don't have a good understanding what leeway, if any, there is in public health beyond these very clear directions that are clarified by the ministry through teleconferences and communicated in writing. So I don't know what and how they were able to do that in other region in the example that you gave. But certainly it's worth exploring. From what I can tell you, any questions to the ministry regarding potentially moving outside of what's currently the priority are usually accepted, but the answer is follow the priority. So that's how we operate here in terms of following that guidance that comes from the province, from the ministry directly.
All right, and I appreciate that. Thank you, Dr. Oglaza. And if you do happen to hear of anything, or there's a secret tunnel somehow we can leverage, please let us know, and please rely on us to help you advocate in whatever way you need to make magic happen. A couple more questions, and then I'll hand it over. So I was just wondering, is there anything specifically our school administrators need to know, and this might be for you, Sean, as well, about these new variants, specifically locally? Like, is there any additional measures that they need to be looking at rolling out to just add on that level of safety and health that that is required?
So maybe I'll start. The new variants, it's the same virus. It just has more affinity to the whatever the spikes are on the surface of the virus, the spike protein that's kind of binds with the receptors in the human respiratory tract and causes infection. These spikes in the new variants are more they fit better with the receptor. So they are fewer of these cells, viral cells, or not cells, viral particles are needed to establish infection. So, but the mode of transmission is exactly the same. It's just the lower infectious dose that can establish that infection. So what's important here is it's the same thing as we were doing with the regular virus. Is our first line of defense is making sure that everyone who comes into school is asymptomatic, because that really already cuts down on the risk very significantly. So through screening, through monitoring throughout the day, prompt isolation, removal from the cohort, parents picking up basically all of these and testing at home if someone develops symptoms, not sending the child to school. This is really what's going to keep us safe, because that virus does not spread, new variant or original virus. It doesn't spread very well if the person is asymptomatic, and that's the key. All the other measures are secondary. So in the off chance that there might be a little bit of asymptomatic transmission, that's where the physical distancing come into play. And the last line of defense is the mask. This is not the first line of defense; it's the last line of defense. And that's the emphasis on that has to be really communicated again to parents, to everyone who is coming into school, to everyone in the community. We, through our case contact management, we have discovered in the past some really troublesome experiences that people would be interacting with others while having symptoms, COVID symptoms, and how they knew it? Well, because their mask was wet, because they had a runny nose. So the thing is, they were relying on the mask, but that's not going to do anything or much if we fail that first line of defense of staying home when sick, and that's even more important with the new variants. We don't need any new extraordinary measures. We just need to be extra diligent about the measures that we all know about, but we might have been a little bit lax. We may think, oh, it's allergies. Well, hopefully that's only allergies, but unless the person has a history of allergies and it happens predictably and there's nothing else really going on, but I would still recommend a test just to be safe at that point. And I think that's really what's worth emphasizing. That approach of just being extra diligent about all the measures in place and recognizing the hierarchy of these measures with preventing people with symptoms from entering in contact with others, coming into contact with others from entering schools.
Okay, thank you. Dr. Toumishey, did you want to add anything?
I just wanted to add, as it connected to the variants, again, this is a point of more similarity, but also connected to the first question of relates to the safety and the environment of the schools and the contrast between COVID-19 and the usual viruses that we know children readily get in typical years, is that, and it appears to be the same for the new variants as opposed to the previously circulating, is that the risk of transmission from inanimate surfaces appears extremely low. Be there if available. And typically when we think of other viruses that children can get and may be spread readily in school environments, the coughs and cold viruses, so typical years, enteroviruses, rhinoviruses, that risk of spread from inanimate objects is a much bigger factor. It's a much hardier virus in the environment, and we have not seen that as being a factor for COVID-19 in particular, which is also adding to the lower transmission we're probably seeing in these environments. It's not saying that there isn't possible risk and lots of safety measures to address those, but it's an aspect of the virus that I think is contributing to how we've seen it spread. It really is people close together through droplets, as opposed to for surface that are contaminated with the virus.
Great, thank you, Lucille. I have one more question, but before I ask, I just have to, hearing you talk and speaking about, making sure kids are asymptomatic. I have 2 young kids, and if they have a snotty nose, I'm like, go blow your nose and make sure this is for real, right? And I can just imagine there are a lot of parents in similar situations, and I'm not asking for data, but I'm just thinking it'd be interesting to know how many kids that are going to school who are later being have cases, whether or not they come from homes where they have parents who are essential workers who can't afford to take that day off work to stay home with their kids. So I'm just throwing it out there. But my last question is around vaccination hesitancy. And I was just curious if we're seeing that in our region, with our seniors, whether or not, we're getting the turnout we should be with vaccines, whether there's hesitancy to, the first one that's available, maybe they don't want that one, maybe any hesitancy within our First Nations community. And just curious if there's anything that we can do to support you with messaging to reinforce the message around, take the vaccine when it's offered to you, or if there's anything we can do to help get a hold of maybe some parents who aren't on listening to the news or on just that even know these vaccines are available to them. And then that's it for me, Lucille. Thank you.
So I can take this one, start with this one, maybe from my experience working with communities with groups of individuals, or even looking at our dashboard, which I recommend you have a look at. It's at our website under COVID-19 cases, but you could actually also look at the stats on immunization. So you could, when you see the vaccinations by immunization reasons, you'll see the coverage of vaccine that we have among different age groups. And these numbers speak for themselves. For example, among the 80+ population, we have over 80%, 83% immunization coverage. Among the population of long-term care residents is 92% coverage, 75 to 79, 83% coverage as well. So these are the groups of individuals who are currently eligible to receive vaccine that they have seen what vaccines do, and they have seen diseases prior to vaccines that were devastating to people, to communities, and they've seen what change vaccines made. So this is a group that's highly confident in vaccine. All the question to ask is which arm do we want? They really want that vaccine. They trust, they have confidence in that aspect of science. So we're not seeing any of the concern here. That's something that potentially could come later on when we are working with other age groups, perhaps people who have not seen the world without vaccines, and maybe that will be a bigger issue later on, which we have to address the same way as we address hesitancy in any other settings, with, for example, immunization of children by parents. So there's some ways and how healthcare providers can help, and we know that simple things like recommendations from a trusted healthcare provider is really one of the big drivers in people choosing to get the vaccine without delay. So we're not there yet. At this point, we have way more people willing, confident in vaccine, who want to get the vaccine, that actual vaccine coming. So we're not seeing any reports of vaccine shopping and sort of not having confidence in one product versus another. People tend to follow the advice of the best vaccine is the one that they can get first. And in this situation with the spread that we see in the community, truly waiting for, let's say, an mRNA vaccine in 2 weeks or getting AstraZeneca now, today, means that that person is protected by the time they get the Pfizer vaccine. And Pfizer vaccine, if they wait for that, they're not protected for almost a month, because it takes 2 weeks after a dose to develop that protection. And with the case rates rising, that risk is much higher in the community, and people make that informed right choice of getting vaccine, the first vaccine that's available to them, and making sure that immunization is not delayed. So we have certainly not seen the hesitancy that might be concerned with other vaccines or with other populations.
Thank you very much. I appreciate both your time. Thank you, Lucille.
Thank you. Anyone else have a question? Mike Brandt. Was that Lisa Ann? Lisa Ann.
No, go ahead, Lisa Ann.
I can wait, Mike. I've already talked. If you want to go first, that's fine. I can wait till after you.
Okay, well, maybe I would just kind of follow up on Allison's. One of her questions was around the vaccination rollout, you know, that has been, and I don't know whether you're aware of the Indigenous community at Tyinaniga First Nations as to whether or not. Now, I know I'm a member here and a resident, and I've received both of my shots, and I haven't really heard though around the numbers of people that have been coming forward. I believe that has been most all the people that can get it is getting the shot. But again, I'm not really sure about that. Do you have any information on that?
Sorry, I'm not sure if I understand the question.
The vaccine.
The question is from Tyinaniga. Go ahead, Mike.
The territory. I'm just wondering if you have any information around the numbers of people who have been received the vaccination shot on the territory with regard to what has been available.
Yes, certainly. So I can share with you the number of doses administered under the category of Indigenous community, which could include others under that Indigenous community reason for immunization. So the total doses administered is 2,020, which based on the estimate percent, it's about 20-30%, 27% of that whole entire denominator of eligible vaccine recipients. My understanding is that the doses, this is something which we work closely with the Community Wellness Center on reserve. We work with the staff there to provide doses, continue booking and support the community with doses. We are expanding the eligibility criteria because of these eligibility is much broader in Indigenous communities on reserve. So I would have to connect with my colleagues from Community Wellness Center to see to check what they see on the ground with regards to the numbers coming. But I haven't heard concerns or reports of hesitancy being an issue, and we support that community with the Community Wellness Center with doses as we receive them. There's some doses coming for the doses coming specifically for the community. So that process continues, and I have confidence that that will continue as long as there's willingness to get the doses. I have participated in 2 meetings with the members of the community where we discussed vaccines, and there were questions about vaccines. They're really good questions and good discussions. And my sense was that well, there might be individuals who make an informed choice of not getting the vaccine. A lot of people who were participating in these meetings had really good questions. I'm hoping that with the answers they will be able to make that informed choice, and if they decide to get the vaccine, these doses will be available for them.
Thank you very much for that. I know it's ongoing, so thank you.
Thank you. Next, Trustee Chatton.
Thank you. Dr. Peter and Dr. Ethan, am I correct in understanding that due to the level of contagion and danger that's associated with the new variant, is it critical for students to mask? And the reason that I'm asking this is because we don't currently have a policy that says if a student decides to, just decides, not can't, but chooses not to mask in a classroom, which puts the staff at a higher risk, it looks like, of contracting in the classroom, should we have a procedure that eliminates that from happening, to actually say you have to be masked in the classroom, to give teachers a bit more teeth behind making sure that everyone is masked in their cohorts and in their classes?
Oh, that's a tough one, and hey, I'm going to let Dr. Toumishey to add to this as well. But with the information that my understanding of and our understanding as a medical community of the science around COVID, mask is one of the important elements, but this is not the only element, or if you have all the other elements in place, so person screens negative, actually does not have symptoms, at that point, whether or not they're wearing a mask should not really matter that much. The risk, the changing of the risk, or the modification of risk for asymptomatic individual, whether or not they're wearing a mask, that's a really very small margin. So I would say, as much as there's public expectation and confidence when everyone around is wearing masks, we also have to have a realistic understanding of what additional benefit that masking provides. So having a one student who, for whatever reason, they want to make a statement and not wear a mask, I don't think that increases that risk very significantly. What's worse, or what increases the risk more, is if that student chose not to disclose that they have symptoms, because that would really, the mask would not really help that much. So it is a balance, and if it is the expectation, if it is the school policy, then certainly that's something that can be enforced. But we have to keep in mind the context in which a mask is not really the only thing. It's the last thing that covers that very small additional risk should the screening fail, or the person develops symptoms while they're in the school setting. So that's something that I think it's probably a maybe a misunderstood element, but certainly if that's the expectation, if that's what makes adds to that comfort level, it's certainly something that could be part of the policy, and it's part of, like, many other rules that school age children need to follow. And basically, this is school setting perhaps is not this place for making personal statements, whether or not that risk related to that statement is high or lower. But I'll let Dr. Toumishey add to this, maybe from our perspective on the case contact management side.
Certainly, and just echoing for the points that Dr. Oglaza made, when we see the effect of the safety parameters and health measures, the true component, or the true safety, comes out in the aggregate of them. So the actions, when we look at the entire class, and masking, distancing, the cohorting that's being done, when we see risk with the individual, so it's not wearing a mask, or brief times when people may be closer, then we don't see the risk profile change that much. And as the greatest benefits are higher up, of eliminating the potential of where people are screening out, they have symptoms, that they get testing. So those are going to have the greater effect on the risk of transmission when we dig into cases and how that would occur. Certainly from the operational side of it, may not be a comment, but I can appreciate the position that teachers are in the front of enforcing these parameters, and that's been an incredible amount of work that they've done over this entire year. So from the aspects of how that is working, and support to be there from the public health side, of want to acknowledge the efforts that the educational community has done to ensure these safety parameters, I think has been crucial to the low rates of transmission that we have seen. So in that, I think it's been a success. The aspect of for one-off and masking, that sort of thing, may not change the class risk, significantly compared to things higher up in the chain. But supporting those actions by educators, I'd say is important for the continued success.
Thank you. Secondly to that, I'm if we were to write a letter advocating from our board, advocating for the full vaccination of our staff, teachers, and our education workers, would we have your support in writing that letter to the province and saying, while they're off, can we please get these needles in arms for this region? Is that a possibility that we could ask of you?
So I'll take that on. Certainly, we support and are very much for immunizations of everyone who is eligible or who is fits the eligibility criteria for the vaccine based on the vaccine product monograph. So we know that certain vaccine are available 18 plus, certain vaccine can be given 16 plus. So anyone we strongly support that. We should have, the sooner we get the entire community immunized, the sooner we are going to be all safer as a community. In this situation, certainly immunization of teachers, the goal of that is protect the people who are on that front line and are supporting the education system and the work for in-person within the in-person learning structure, and it also instills confidence in the school system. So certainly there are very much there's significant benefits of that, and I think we have to, as long as we realize that there's this is advocacy to add an additional group to a already scarce resource that it still might be outside of our power to influence these decisions, but certainly advocacy for different groups is already what's happening on different levels. And if from public health, I support all these efforts, but I know that all of these efforts cannot all get the result that's coming from these advocacy letters. But in terms of support in principle for immunizations, for extending that protection to the group of essential workers who cannot work from home, teachers included, for in-person learning, that certainly I do support that advocacy.
The reason that I asked that is because you had mentioned that you were anticipating around May. That leaves 1 month where teachers are actually, and education workers are actually in front of students when they really need as quickly as possible to have that protection, like with immediacy. And with this week off, I'm really hopeful that we will be writing an advocacy letter to our ministry, to the Premier. I would just like to have your join us in doing that. I would appreciate that.
Thank you, Lisa. I did send a letter to them last night or this morning asking, and it had to do with the emails that go through with the teleconference. And I did get a response back, but the response was very generic. But the minister got pretty heated when that question was pushed today, because he said, it's not like we're holding back on anybody. It is all based on supply. We are in phase 2. He said, we are moving through as best as we can with supply. And so I think he must have heard from a lot of us to say that. But Sean, did you catch that when he responded to that question?
Yeah, I think he did. He was pretty assertive today, because the question was about vaccinations, and the letter that you all got tonight. And Peter, I'm going to flip you that letter. I don't know if medical officers of health got it. It came from the minister and co-signed by the deputy, and it was part of the announcement. But it spoke to the prioritized vaccination regimes, identifying staff that work with students with special needs and other particular hotspots in the province that are considered case count hotspots. And we didn't have that memo, actually, Lisa and Lucille. He actually quoted the memo, but he didn't realize we didn't have the memo. I don't know if you caught that, Lucille, but he said you already received the memo, and we didn't actually have the memo yet. It came after, so we didn't really know what he was talking about. So maybe that's why he got a little bit assertive.
Well, and I sent it to the trustees the moment I got it. So that's how long after it took to come to us. But you're right. So does any other trustee have any questions for the doctors so we can let them go home? I guess they are home, but put their feet up. Anyone else? I don't see any more questions. I want to say thank you to Ethan and Peter for joining us tonight. And I think we all learned a lot. There were some things that were answered that I didn't really understand. So we appreciate the time you've taken and the work you are doing and the communication you've had with our board and our staff and the help that you have been. So thank you very much.
Well, thank you very much for the opportunity. I appreciate the opportunity to be here today with you and speak to you today, answer the questions. Thank you for Dr. Toumishey for joining me as well. And
thank you very much.
Thank you.
Bye now.
Thanks. Bye.
Bye. So at this point, we will leave the rest up. If you have a question for Sean, this is the time to ask him. Lisa Ann, is your hand up?
It was up from before, I'm sorry.
Okay. Krista McConnell, you have a question?
Thanks, Sean, for gathering that information about the number of students that will be absent during this week. What do you think that we should be concerned about this right now, or should we look at this again? What could be the possible scenario after the spring break? What do you suggest we do for those 700 and some students that now are just sitting at home and they're not even being educated virtually? Some of them are. I would say some teachers have prepared things and are going above and beyond, but there's probably some students out of that 741 that are not getting educated through this whole week. And I'm not sure if that's going to continue on later, just because parents aren't comfortable at this point, and we have no way of them transitioning into the virtual learning because that point has passed since January. So wondering if that's an option. I hate throwing that out there to you, but I'm wondering if that's an option for students to make one more transition into the virtual school.
Right. So I would say that we can't rule anything out, Krista, right now. Like, if there's one thing we've learned, it's to be about as nimble. And public education, district school boards are not known for being nimble. Like, they're not. So we've learned to be nimble. That's not a criticism. That's just a fair assessment on all of them and public sector. But what I would say is a couple things. I want to just speak to the dilemma you raised about those kids whose families chose to keep them home either yesterday or for their entire week. The number is significant. When you asked that question yesterday, the reason I got on it because I was actually interested myself. And there are some particular hot spots, if you will. What we didn't do, I would say most, this is a generalization, a lot of teachers have materials ready for students so they can work from home. What we aren't doing this week is we aren't asking our teachers to provide video or live streamed asynchronous teaching and materials and on top of the kids that are in front of them. And I think it was either Lisa Ann or it was Allison that raised the question about staff fatigue. So we made the decision not to intentionally ask staff to do that. Notwithstanding the fact it's a break next week, we'll be watching the numbers in the Hastings, Prince Edward area, like you will. if those numbers don't change and they go up, and we have, even though kids aren't in school because it's Easter, but if there's students that are in our system or close contacts of students in our system, then we're going to have to make some decisions. And what I really don't want to have happen, honestly, is that we have to make the decision here at the local level again to, what are we going to do? Because I know from talking to some folks, the North doesn't have many cases. So why does the North have to go into remote learning but Belleville does have a number of cases? And I would prefer the minister, and I don't want to play politics here, but I really would prefer the minister and the government to make the decision and say, you're either all remote learning, you're all learning from home, or you're not. And I don't know if he's able to do that. And they don't have the data right now, but I would say this time next week, this is what, Wednesday? So I would say next Thursday, they're going to be looking at things very closely. And I just don't have an answer for you that predicts what we can do after the spring break, because I just don't know. And I know that's not very reassuring, Chris. I know it, but that's,
No, I completely understand that things are unpredictable at this point. I'm just wondering if we have a plan to even just sit down and next week, a week from now, and say, hey, what's going on? What do we think the province is doing? And what maybe our actions should be, if anything, right?
What I would say to you, if we go remote learning, like teaching remote learning again, we'll be ready. Like the letter that goes home tomorrow will again ask everybody to take their stuff home, their equipment, their SIA stuff, but it won't be a like we might have to go remote learning for one school if we get a bunch of an outbreak, but I don't see that. I think it's either going to be a provincial directive, like we're in a provincial what did they call it? Stay-at-home order date. As of tonight at midnight, we are in an actual restricted stay-at-home order, and that order is in effect for 4 weeks. We'll be ready, Krista. We'll be ready. It's just this week to get through the end of the week. We'll be ready for what happens after the post break.
Okay, perfect. Thanks, Sean.
Just to piggyback on what
Thank you. And I think the stay-at-home is tomorrow night at midnight. That's what I understood, but I might be wrong. Lisa Ann?
How are we going to know about an increase of case data? Because the directive from the ministry that they were not requesting any updates over this the break. That daily, the check-ins with students were not going to be happening. Are we going to be doing that?
Yeah.
Despite the directive?
Public health will continue to inform us, Lisa Ann, as to what is happening in case counts. So in cases in our schools.
Okay, awesome. Thank you. And the other thing I wanted to just bring up was that the overwhelming narrative that I keep hearing from the teachers and education workers that have been reaching out to me has been that they don't have a clear safety plan that is any different than what had been implemented before this variant entered our community. And that's why I was asking the specific questions I was asking of the doctors tonight, because I don't know whether we're able to put something out that's very concise as to what it is that we have changed or what it is that we're doing more of or better in order to help ensure the safety of the staff that are in the schools and the students. I'm foggy on it myself. I don't even know if we have like further janitorial deep cleans that are happening over the break. I'm not sure what we are doing to ensure that they have those in place. And one of those things was about the masking. That was why I was asking that question. If it was critical to ensuring the safety of the cohort and the classroom, do we create a policy at this point? Because we didn't before, and that was a bone of contention with a lot of the secondary school teachers. I don't know whether that's something that we can revisit and potentially put on the table as a procedure. Like, no, you do actually have to wear your mask in class, or you do have to leave and go to another location. Is that something that we could do? Can we add to what we've already got in place?
Just a question to do with that before you answer, Sean. Have you heard of any principals or staff saying that there are students who are absolutely refusing to wear a mask?
Okay, so there's a couple of things. So I haven't heard, I think I may have heard of 2 cases since September. Now when I say that, I don't want you to say there's only 2 cases in the entire board where 2 kids have refused to, I mean, what I'm saying is I just haven't heard from it. I have heard that kids have overwhelmingly been compliant. I know there's probably more than just 2 kids out there that are refusing to wear a mask. And I mean, I have a 17-year-old that forgot a mask one day. So, I mean, we had to, you know, but in terms of the, like, you know, whether we develop a procedure policy that, you know, the policy world is the world of the trustees. I guess what I'm trying to say is, I'm not trying to say there isn't an example or examples out there where kids have refused to wear masks. What I'm saying is that overall, the kids have been, actually, to be honest, it isn't the kids that we worry about. Sometimes it's the adults who refuse to wear masks and come into the, you know, or come into the building or not. But I would leave that to you. And I just want to come back to the deep cleaning question of Lisanne. Yes, Lisanne, we are doing deep cleaning over the break. We are doing that sanitization. It will be in the letter. It's included in the letter. I mean, you know, we've drafted the letter and I finished it off this afternoon. It is included in there, the deep cleaning and all those protocols. And the questions you asked around masking and enhanced masking based on the rise of these variants, you asked the 2 best people you could have asked tonight. Like, I couldn't give you information on that. They gave you the answers that I couldn't give you. So, and I trust them. I have to trust them.
Thank you. Anyone else? Allison Kelly.
Yeah, super quick, Sean, just kind of going off of what Lisa Ann was saying, and I think maybe some of the confusion is the minister likes to state that these new enhanced protocols, safety measures, and he says that, but then we heard from Dr. Oglaza just tonight that the variants and the transmission, while it's different, it's a lot of the same. So the protocols haven't changed. So I'm wondering if maybe there's an opportunity, and that's where I'm coming from. Like, well, he's saying we have new protocols. What are they? And then today he's saying, oh, we're going to vaccine more people, right? So I think that's some of the challenges when you have a government who sometimes says things. And so the parents are reading these, because I think parents are hyper aware, like most of us are, and then waiting for, where are those extra protocols? We aren't seeing them. Why aren't we seeing them? What are we not doing, right? So that's just a comment more than anything. But anyways, I really appreciate this call and having the opportunity to talk. I know I've been very anxious this week, so I'm very grateful for all your energy and the information and sharing, etc. Thank you, Lucille.
Thank you. And that came up today in the conversation too, about cleaning, that the March break will be used for custodians to go through and do a deep clean and get everything new again. But I have, just you saying that, Allison, I have heard of some schools where they feel like the custodians they're getting sloppy and that could be true, and it might not be, but with cleaning the desks every night and whatever, like at first there were a lot of things going on. And the other piece around the minister, I don't think he really says they're new. I just think he's just trying to revisit over and over again the same messaging, that all of these things have to take place in order for us to get through this. So I think that's kind of where he was coming from, especially today, but I don't know. So Sean, any comment on that?
I just think that it's just an incredibly difficult time. Like, it just is. I mean, we're not allowed to express frustration publicly, and it's hard because we get caught off guard. Like today, you wouldn't know this, and look, it was just timing. But Lucille and I were messaging each other back and forth. We went on a call today with the minister, and Lucille, and the first call was canceled, but then he came on and said, like, I'm sorry, I'm hanging up on all of you because I can't jump the queue with the premier. So sorry to inconvenience you, but I'm going to cut you short, and we'll come back in a couple hours. And I said to Lucille, never in my career have I ever seen that. And so there's just
and it was moved from yesterday. This time. Then he ignored it. We went on with the premier. Then I got kicked off, And then we were back on with we were all afternoon waiting.
Yeah.
So yeah.
And I think if I could, no, I was just going to say, for the last 14 months, we have been reacting and reacting and reacting. And when you want to be a strategic organization, it's hard to be strategic and forward thinking when you're constantly reacting. And I just keep reminding myself, we're in a pandemic. But, you know, to your comment about the fatigue, it is very fatiguing and exhausting. And, you know, when a comment is made about enhanced protocols, and that goes out in a tweet or that goes out in a soundbite, then we get questioned, what are those enhanced protocols? And then I have to go back and look, and you find out, well, and then you heard from the medical officer health tonight that, well, they're really not enhanced. They're just what we've always been doing. We're just making sure that we're being vigilant, and we're doing what we should have always been doing anyways, which is social distancing and wearing masks. And enhanced means vigilant. I think these next 2 weeks are really, really, really important. They're really critical for us. So I'm hopeful.
Is it possible
And just for
to meet again, Lucille, on the 19th before we come back? Sorry, the 16th.
Say that again.
Is it possible for us to meet again as trustees on the 16th, just with Sean, just as the trustees, with the doctors, just to go over what is happening for the 19th?
I don't think we should put that on the doctors. We can ask like we did today, and they were available, but
no, without the doctors. I'm talking just the trustees and Sean.
Okay, so you said with the doctor.
No.
Is the 16th the Monday after the March break?
No, the 16th is the Friday of the break week.
I'm not interested in coming back unless there is like a huge emergency. We need to take a break, all of us. Like if there's something urgent, Lisa Ann, for sure, but not just to do it. What does everybody else think about that?
Lucille, it's Krista.
Yes.
I think that it's important just for our own mental health to kind of know what's going on for the following week, whether it be a half-hour call where Sean just gives us a briefing of what's going on or what's been decided. I think that tentatively we should schedule something unless we know provincially to move to virtual learning. In that case, like Sean said, we're ready to do that anyway, so we would know that we're moving forward with that.
I think if anything, if there's anything, I don't even want to ask Sean to do anything for the March break. I don't think it's fair. Unless there's something urgent. What about if there is something urgent?
My reason for asking about that is because on the weekend, before kids go back into classrooms, that's when the trustees are going to be bombarded with more questions from parents, more questions from teachers, unions contacting us, education workers contacting us. And I would like to make sure that we have the same messaging that is going out to everybody. So if that's something that can be communicated over email before we encounter those problematic situations where, and again, it's because of the temperature that is out there right now. Everybody is so scared. Everybody is so upset for a variety of reasons, but they're very much focused on education, their children, and our system. And if we don't have consistent messaging that we have ahead of time before Monday, that's where my frustration with getting this meeting together came from, because I didn't feel like it was asking a lot to come together to talk about how critical a situation we were in as a community because of the numbers that we were looking at. But it proved to be very difficult to get this together. So I don't want this to happen again. And that's why I'm asking ahead of time to see if we can get it on the books, if it's possible. If it's not possible and it's something better communicated by email, I'm totally fine with that. But we need to decide how we're going to get messaging out to all of the trustees so that we have answers for these people when they come to us.
Well, and I think in fairness to why there was resistance, it wasn't to have a meeting. It was to get through Monday to see, like Monday after Easter, the first day of school, there's going to be this buildup every time we're off and come back again. It's going to happen. So if there are like huge changes and we just see numbers flying, for sure, communication does need to come out, and they will, like Sean will know, our team will know how many schools would be affected by those students or what students aren't coming back. But again, parents, if they choose to keep their children out for the first couple days, just for peace of mind, like nobody's making anyone feel guilty for choices. And I think we need to leave that up to Sean, but at the very least, if we see an email and there's some radar or some concern, then let's visit that. Like over the weekend. But if not, let's just enjoy. And like many of you have young families, and you need to take time and just relax. And I can't say that enough. And our staff are exhausted, and that came across provincially. Senior teams, directors, they need a break, and they're going to be working anyways. But at the same time, we just need to. That Monday's going to be like that, whether we get together, whether we know, whether we plan or not. There's still going to be that sense of anxiety. So let's wait, and we'll all be following the numbers. And so we will know by Friday how much they've gone up. So if we could just say, let's wait and see there. And then Friday morning, I will send out a note if I've seen the numbers going really high. Sean has his hand up.
I was just going to say, to reassure everybody, like I can see the anxiety in some people's faces. And I guess what I would say, if you're concerned about the prospect of sitting at home on a Sunday night without certainty of what's happening Monday morning, you need not to have that concern. Okay, we will be ready, and you know, even though there's lots of changes that happen kind of on the fly, that's not one. We will be able to make sure that our families are informed based on provincial direction, of course, and if there is a dramatic shift one way or another, Lisa Ann and Krista and to the whole group, be sure, even though it's the break, I will know about it, and I will be communicating with Lucille and all of you, and we will be ready. So, okay.
It's Bonnie
Good.
here, and I agree with what Lucille just said. It's okay. And Sean too. They need a break. Thank you.
Okay, thank you. And the other piece around this video, we didn't even have 48 hours notice within ourselves. This was just planned. I do not have a problem with this going out in public. I think it's really necessary for families to be able to see this as a resource. So I know there was something said at the beginning that public need 48 hours. We're not sneaking around to have this meeting. It was urgent, and trustees came forward, and they had questions, and we met. So I appreciate Debbie coming on at short notice and recording this. And any other comments or questions from anyone else?
I really appreciate that, Lucille. Thank you.
You're welcome. Mike?
Yeah, thank you both, Lucille and Sean, and everyone who is here this evening. I think this has been very informative, and that we've all got a lot to continue to work on. Thank you.
Thank you, Lucille. Well done.
Thank you all. Have a great evening.
Yeah, take
Good night,
care,
everybody.
everybody.
Thank you.
Good night.